So think about that. If you do any weightlifting, if you pick up any weights at all, you have a 10% less chance of dying. Interestingly, the effectiveness of physical activity for improving depression, anxiety, and distress has been shown to be equivalent to taking antidepressants. In this study in particular, diet didn't do anything, and you wonder why people are trying to modify their diet and struggling with diabetes and glucose levels. Well, perhaps it's because they're not adding strength into their regimen. So in order to get these benefits, you don't need to be going out and doing an hour or 2 hours a day. If you're just doing 20, 30 minutes a day, you can receive benefits immediately that help you feel better. Welcome to Foundations First, Health, Strength, and Success. We're building tomorrow, starting today, based on the best available scientific evidence. I'm Dr. Patrick Dennard, an orthopedic surgeon. You may ask, why another podcast on health, strength, and success? It's a great question. Well, as an orthopedic surgeon, I have the opportunity every day to see people who are not living their best life. And I want to continue as a physician to share the best available scientific information to help you live your greatest life possible. Today's podcast is muscle, the organ of life, longevity, glucose control, and mood. You've heard a lot about these factors probably around you already, and we're going to review the best available scientific evidence, give you some details on why muscle strength and building is important for longevity, dive into the mechanisms of glucose control, and also talk about how muscle strength and working out is really important for mood, perhaps even better than antidepressants. So as we're going to go along, you'll get a lot of interesting details and perhaps bring some actual items to your life. Today's podcast is sponsored by Complete Surgical Nutrition. The average American will have 6 surgeries in their lifetime. Evidence shows that nutrition is an important part of recovery. Supplementation can improve speed of recovery and lower the risk of complications. CSN was formulated by surgeons to help optimize your recovery after surgery. If you or a loved one are having surgery, more information is available at www.completesurgicalnutrition.com. Why are we talking about muscle? Well, first, some interesting facts about muscle. Muscle makes up a large portion of your body weight. In fact, it's about 50% of your body weight, and you have over 600 muscles in your body. So we need to be really paying attention to why we have something that's such an important and prevalent part of our composition. Interestingly, according to a study from the CDC in 2023, if you look at the guidelines for what is recommended on exercise, only 28% of Americans are meeting the recommended guidelines for exercise, which we're going to cover. So a lot of people are ignoring this critical aspect of our body. Again, we're going to talk about longevity, glucose control, and mood, which I think are some of the 3 most important reasons that you need to be paying attention to building muscle strength with lifting weights, regardless of your sex or age. So let's start with longevity first. I want to review a couple of studies. The first study was published in 2022. This was independent and joint associations of weightlifting and aerobic activity with all-cause cardiovascular disease and cancer mortality in the prostate, lung, colorectal, and ovarian cancer screening trial. So again, this was published in 2022. Interesting study design. It was started in 1993, 10 centers in the United States. They had over 150,000 men and women ages 55 to 74. And they looked at cancer incidence and mortality in 2016. So they had a 23-year follow-up period, a long follow-up to look at, and they did a follow-up questionnaire on activity. On that follow-up, they had almost 100,000 people with over 10-year follow-up. 28,000 people died. Now, 23% of those patients or people reported weightlifting, which is very, very low, as we talked about. 16% reported weightlifting 1 to 6 times a week. If people did any weightlifting, they had a 9% lower mortality after adjustment for aerobic activity. So think about that. If you do any weightlifting, if you pick up any weights at all, over that period, you have a 10% less chance of dying. Now, if they lifted 1 to 2 times a week, it was a 14% reduction in mortality. So almost 15% reduction, which is 1 in 8 or so. Among non-weightlifters, if they did aerobic activity, so cardiovascular exercise, vigorous walking, running, etc., those people had about a 30% reduction in mortality. If they did any weightlifting, they had a 9 to 22% reduction in mortality. The best, of course, was combining. If you did aerobic exercise plus weightlifting, which is the WHO recommendation for exercise, over that period, you had a 41 to 47% reduction in mortality, a huge difference. Now, this isn't the only study that has found similar findings. Another study looked at Korean adults. Okay, this study was published and looked at 35,000 individuals from Korea, went down to a younger population, so they were between the ages of 20 and 79. They started the study in 2007 and had follow-up out to 2019. Over that 9-year follow-up, people were average age of 48 years at baseline. The vast majority, again, did no weightlifting. It was 73% that did no weightlifting. And it turned out in this study, just lifting twice a week was really a sweet spot that provided a lot of benefit. So it's not as if you have to be lifting weights 5-6 days a week. Even a couple of days a week is going to go a long way. So I mentioned the WHO guidelines, the World Health Organization guidelines on exercise. What are those? That's 150 minutes of aerobic exercise a week, as well as 2 days of strength training a week. So in this study, they looked at that and they said that people that did not meet any guideline, so they didn't either meet the aerobic exercise or the strengthening, they had a 34% higher risk of all-cause mortality and a 68% higher risk of cardiovascular mortality. We're talking people that are average age of 48 years of age with just a 10-year follow-up. That's a huge difference. If you met either of those guidelines, you had no greater risk of mortality over that time. This is a big motivation to start getting into the gym. Let's sum up the muscle data, though, here. Essentially, what it's showing is that muscle strengthening provides a separate benefit on top of aerobic exercise. Now, I want to move on to glycemic control because I think that really shows why muscle strengthening is so important and shows a distinction with cardiovascular activity. So if we look at the number of people in the United States that have diabetes, it's estimated 11% of people in the United States have diabetes, which is about 38 million people. It's also estimated another 15% are going undiagnosed. And if you look at pre-diabetes as well, which is just slightly not meeting the guidelines, but they have elevated glucose in their blood, it's about 1 in 3 people overall. So if you turn left and you turn right, somebody around you is going to have pre-diabetes. This increases with age as well. As we know, people get heavier and heavier with time because they're not doing exercise. The prevalence is around 20% between ages 45 and 64, but it increases to 29% for diabetes alone over the age of 65. So what's important to understand is that muscle is one of the biggest sources of driving glucose from your bloodstream into the body, okay? So what happens is as you develop more muscle, you have a greater capacity to drive glucose from the bloodstream into your muscle so that your cells are not as being subjected as much to that high glucose level. Exercise can reduce insulin resistance and improve glycemic control. It also lowers your blood lipid profiles, that is your cholesterol, triglycerides, etc., even in people without type 2 diabetes. So it's a very important thing to be paying attention to. Now, much of the evidence that we have with regard to strengthening and glycemic control comes from individuals who have diabetes. A systematic review, for instance, published in 2021, looked at 14 studies, almost 700 patients. They found that results of strength training dropped HA1C levels by 1 point. Now, HA1C is a reflection of your blood glucose levels over time, and 1 point is a substantial difference. Interestingly, in this systematic review, strength training was more important than dietary modification for lowering your blood glucose level. In fact, in this study in particular, diet didn't do anything, and you wonder why people are trying to modify their diet and struggling with diabetes and glucose levels. Well, perhaps it's because they're not adding strength into their regimen. Another study in 2021 looked at a comparison of different exercise interventions on glycemic control in people who had pre-diabetes, so a little bit lower blood glucose levels. This again was a meta-analysis of 13 studies over 500 patients. They looked at aerobic and resistance training. Both decreased the HA1C levels, But if you combine the two, the patients had greater improvement in their body mass index, that's their overall weight with relation to their height, their insulin levels, and their fasting blood glucose. So I think it's important to bring this home and help understand why strength training provides a distinct benefit compared to aerobic exercise alone. And they work by different pathways. So if you look at aerobic training, it works via the AMP activated protein kinase pathway, driving blood glucose levels down. But muscle has a distinct pathway, and that's via a distinct glucose transporter translocation. And so when you're combining these, you're hitting glucose levels from a different standpoint, okay? And that's beneficial because you can look at blood glucose and say, well, I don't meet the definition for diabetes or prediabetes, but we know that the more your glucose levels are elevated, the more you are at risk for disease such as cancer and cardiovascular disease. And probably the guidelines that we have are not sufficient enough currently to really prevent disease. So rather than waiting to get the diagnosis or waiting for that disease to occur, if we can start thinking about this earlier in our 20s, 30s, and 40s and develop consistent patterns and habits that help you live a longer and healthier life, that's going to be to your benefit. So the third major reason I want you to think about strength training is the impact on mood. And we know that many people are now taking antidepressants. In fact, the numbers suggest that 1 in 3 Americans is taking an antidepressant. So we have a huge problem with depression and anxiety in our culture, and perhaps that relates to the lack of exercise. Now, strength training in particular results in a release of dopamine, which gives you a good feeling. And if you look around, you see that people who exercise a lot, particularly if they do strength training, they just tend to be happier. So I want to go into some of the data that looks at this in relation to mood, in particular in comparison to antidepressants. And perhaps I think you will conclude that there may be a benefit of doing strength training. This may be something you want to consider even before considering antidepressants if you're one of these people who suffers from anxiety or depression. So the first study is the efficacy of resistance exercise training with depressive symptoms, a meta-analysis and meta-regression analysis of randomized controlled trials. This was published in the JAMA Psychiatry Journal in 2018. It's a meta-analysis of 33 trials and about 1,900 patients. So meta-analysis is where you combine multiple studies so you can put together the data and get more information. Rather than having a small number of patients, you combine to get a large number of patients. So they showed that resistance training led to a significant and moderate reduction in depressive symptoms. Interestingly, the effectiveness of physical activity for improving depression, anxiety, and distress has been shown to be equivalent to taking antidepressants. Another meta-analysis of over 1,000 studies and over 128,000 patients looked at the effect size. And the effect size of exercise for lowering depression and anxiety was actually larger than psychotherapy or medication use. Now, what's interesting is that they also in this study looked at the duration, and just a short duration was as effective as a long duration. So if people were exercising just 30 minutes, that was as effective as exercising an hour. So in order to get these benefits, you don't need to be going out and doing an hour or 2 hours a day. If you're just doing 20, 30 minutes a day, you can receive benefits immediately that help you feel better. And that goes along, and not only is it going to help you feel better, but we know from the metabolic standpoint, it's going to drive down your blood glucose levels, and it's going to help you live a longer life. So who doesn't want to live a longer, healthier life? All right, let's summarize these findings. I want to give you 3 takeaways that I think are important to take out of this information. First off, strength training, as we have seen, has distinct benefits from aerobic activity. Aerobic activity is very beneficial, but if you look at the addition of strength, that provides additional benefit for reducing your overall mortality over time. Secondly, strength training improves glucose control. And this gets into mechanistically why you see that reduction in mortality over time. And then it has to do with the different mechanism by which the development of muscle leads to lowering your blood glucose levels. And again, I think and believe as a physician that it's important to shoot for levels that are lower than are commonly recommended. The third thing is that regardless of this, strength improves your mood. In fact, if you look at strength training, it appears to improve mood as much as pharmacotherapy. Personally, for me, what this means is that if I'm not feeling good and see this, I go exercise, I typically feel better. But I think for people who struggle with anxiety and depression, they should really consider adding a strength training program to their activity. Now, how do you do this and make this practical, right? Because I'm telling you, you need to go exercise all the time, do aerobic activity, and also strength training. If you go back to those WHO recommendations, it was 150 minutes of exercise, of aerobic exercise a week, and 2 days of strength training. And we saw that even 2 days of strength training was sufficient based on that study for Korea. So I think if you break that down, what I like to do from a practical standpoint is just commit to exercising every day. So I'm a big advocate of what Shane Parrish talks about in creating rules. And by having this rule that I exercise every day, if I just do that 20 to 30 minutes, I'm going to meet those guidelines. And over time, I'm going to have a lower mortality. I'm going to have improved glucose control, and my mood is going to benefit. So thanks for listening to the Foundation's first podcast. I hope you enjoyed the scientific evidence I shared with you, and hopefully you can take away some of this information, incorporate strength training into your daily life if you're not already doing that. The studies that I cited will be available in the show notes, and I hope you look forward to other episodes. In the next episode, for instance, I'm going to talk about why glycemic control is important and why, as an individual without diabetes, I wear a glucose monitor. We're going to look at some of the science there and how I think this is something that could be beneficial and impact your life if you give it a try. So if you enjoyed this podcast, please like it, please subscribe, and if you feel so compelled, leave us a 5-star review. I look forward to giving you more information as we go forward.